Everybody in the U.S. will get hypertension eventually if they live long enough. This doesn't have to be the case. I'm Mike Klag, and I'm Dean of the Johns Hopkins Bloomberg School of Public Health.
And I'm Brian Simpson, editor of Johns Hopkins Public Health magazine. We're talking with Dean Klag today about hypertension and salt. Dean Klag, tell us about the Yi people of China and their impact on the science of hypertension.
Well, Brian, the Yi people are an ethnic minority that live in southwestern China. Several years ago, Dr. John He, who was a student here and a physician from China, and I and a whole group collaborated on a study of Yi people. And we were interested because what Dr. He had documented is that the Yi people who lived up on mountaintop villages in remote areas and lived an uncultured lifestyle did not get high blood pressure. And then in a follow-up study, the Yi migrant study, demonstrated that after living in urban areas for 5 years or more, they had a pattern of high blood pressure that was just like we see in the U.S. and in Han people in China. That is that with increasing age, the blood pressure goes up and the prevalence of high blood pressure goes up. And we now know from other work that if a person lives long enough, essentially their risk of getting hypertension approaches 100%.
And what were some of the specific dietary factors that affected hypertension?
Well, there were many factors that influenced the differences between the Yi people and the migrants. And so, as I said, high blood pressure was non-existent in the Yi people, and that was because they ate less salt, more potassium, they exercised more, and were leaner.
And if the average American virtually eliminated the sodium from his diet and took higher intake of more potassium, would his blood pressure plummet?
Well, we evolved to live in a low salt environment, to be in open grasslands where we had to conserve salt and water. So we're very good at conserving salt. I should just say that it's very, very, very difficult to eliminate salt. So we're really talking about not eliminating salt, but moving to a lower salt intake.
And what will it take to really reduce blood pressures across the United States?
High blood pressure is an underlying cause for much of the cardiovascular disease that occurs in the U.S., the leading cause of death. And to have an impact across the society, we need to shift the distribution of blood pressure in the population to lower levels. To do that, we need to influence the way the population eats. And much of the salt that we eat is in processed foods. It's in breads and prepared foods. And so we really have to work with manufacturers to decrease the salt intake of the U.S. population.
And what would you say to people who say we don't need more policy, that or regulations, people just need to take responsibility for themselves and their diet?
Yeah, well, certainly we all know as public health professionals that the determinants of health are multifactorial. But right now in the U.S., if you eat at a restaurant or eat food that's processed in terms of canned or frozen or somehow prepared, it's very, very, very difficult to avoid salt because much of it is not salt that we add at the table. So we really need to work with the food industry and food preparers to lower the salt content of the American diet. We know that through diet, such as the DASH diet, we can lower blood pressure as much as a medication can. And in subsequent work, investigators looked at the Omni-Heart diet and showed it was both a heart-healthy diet and it lowered blood pressure. And that's probably the diet that most Americans should be looking at as adopting for their own health.
And are you optimistic for the future? Do you think that this is really an achievable goal to lower hypertension across the U.S.?
Oh, definitely. There's no question about it. We see big differences between societies. We know what causes those differences in prevalence of hypertension. We can take steps toward it. And the CDC has recognized this and has refocused their efforts in looking at how we improve the American diet to prevent cardiovascular disease.
Dean Klag, thank you very much for talking with us today.
It was my pleasure, Brian.